My name is Stephanie Price, and my population of interest is incarcerated adults in the state of Alabama. In this discussion, I'll be talking about STIs, STDs, and how my population of interest is affected, and what we as nurses can do to lessen the impact of burden on the incarcerated population in our state. Let's just take a moment to understand what incarceration means. So, the Merriam Webster Dictionary defines incarceration as confinement in a jail or prison, the act of imprisoning someone, or the state of being in prison. So, how many Alabamians are currently incarcerated at this time in 2024? In state prisons, there are approximately 25,000 inmates. Local jails, 14,000 inmates. In federal prisons, 3,400 inmates. And in juvenile correction facilities, approximately 800 underage inmates. The Alabama Department of Corrections gives us insight into answering the question of who is in jail and what people typically make up the inmate population. Be sure to take just a moment to notice the table of statistics published by the Alabama Department of Corrections posted here. Noticing that the largest percentage of inmates are typically black males, followed next by white males, then white females, black females, males of other race, 274 inmates, and then females of other race, approximately 5 inmates, for a total of over 26,000 total inmates. It's also noteworthy that approximately 90,000 people are booked into jails across the state of Alabama each year. So your question may be, are sexually transmitted infections common in Alabama, and why are incarcerated people at higher risk than the general public? Sexually transmitted infection rates have been increasing every year in Alabama, especially in the younger population, aged about 15 to 24. The inmate population tends to encompass a higher number of at-risk people, including those with lower socioeconomic status, lower educational levels, poverty, multiple sex partners, IV drug use, previous sexually transmitted infections, commercial sex work or prostitution, unprotected sex, a violent history, a history of sexual assault, and male-to-male sexual contact. So let's look at some statistics for the state of Alabama provided by the CDC. Syphilis, gonorrhea, chlamydia, and HIV are a few of the STIs that we'll look at today. So when we look at syphilis, what we notice is that the rate of infection is 3 times higher for males than females. The highest rates, again, are in that age group of 15 to 24 years. The rate of new cases is almost 6 times higher in Black people than in white. And as far as the Hispanic population is concerned, those rates have doubled from 2018 to 2019. Gonorrhea. Rates, again, are higher in males compared to females. The Black community does tend to have the highest rates in comparison to the white community. The highest rates of infection, again, are in that 15 to 24 year age group. Chlamydia ranks 8th nationally for the state of Alabama in transmission and is still the most common STD as of the year 2019. Black persons do have a higher rate of chlamydia infection than white, and females in this case have a higher rate of disease compared to males. HIV. Black people encompass 72% of newly diagnosed cases of HIV in the state of Alabama and are 3 times more likely to be diagnosed with HIV than white people. Now let's take a quick look at STI prevention levels and the role of the nurse therefore. So we'll look at primary, secondary, and tertiary prevention in the upcoming 3 slides. In primary prevention, it is very important that we as nurses provide adequate and accurate sexual education before a person's sexual debut, which essentially means before their very first sexual encounter. So we want to think about speaking to those younger adolescent groups, maybe middle school, high school. Take to social media. We're able to do that to provide educational material in a place that they're going to be more likely to find it. And then also as written materials, pamphlets, handouts, these are things that can be given out in the appropriate setting. In the case that behavioral counseling is needed, that may be something that the nurse may provide, or maybe she'll provide the referral for an appropriate counselor to see this person before their initial sexual encounter. Condom use, condom education, I think this has been going on for a long time, but it's very important that we continue to teach the younger generations how to use a condom, how to wear them correctly, and how to obtain them at a low or reduced cost, and how to receive condoms discreetly, and certainly not to be embarrassed about condom use. We can also look at pre-exposure administration as far as maybe HPV vaccines and pre-exposure prophylactics like PrEP therapy for those who are having planned sexual encounters with a person who is or may be HIV positive at the time of that sexual encounter. In secondary prevention, the nurse is going to help to provide resources to help the infected individuals seeking treatment and to help prevent the spread to other non-infected partners by confirmation of infection through testing, expedited treatment for individuals and all sex partners. Of course, this would be done in a non-discriminatory way. And then also counseling referrals as needed on an individual basis. And the third level of prevention, the tertiary level, is when the nurse is going to focus on reducing death and disability in patients to minimize complications, for patients to return to their prior level of functioning, and to improve overall quality of life. The goals may be met by antimicrobial or antiretroviral therapy, through participation in support groups and other rehabilitation programs. So STI screening, is it really worth it, especially in the incarcerated population? So by screening entrance into both local jails as well as state prisons, the rates of STI transmission can be reduced. Screenings are offered typically at a low or no cost to inmates. Now, chlamydia and gonorrhea may be screened in an opt-out fashion, while HIV and syphilis testing for all entrants would prove beneficial, as these are both reportable to the state of Alabama. Both gonorrhea and chlamydia rates are higher among the incarcerated population than those who are not incarcerated. Now, about 50% of entrants, now these are people who were just being arrested, just coming into jail, they're typically released within 48 hours. So screening must be done promptly to achieve the best outcomes regarding prevention, confirmation, and treatment options for these at-risk individuals. A couple of cost-effective ways to screen inmates are by blood sampling, urine sampling, nucleic acid amplification testing, and pelvic exams. Listed here are just a few community resources located throughout the state of Alabama. And references. Thank you so much.